Hello friends, this is Tanya Divedi and I'm here to discuss a very serious topic which has become a matter of great concern all across the world, that is a novel coronavirus. Now here I will be covering four topics. The first one is what is coronavirus? The second one is the symptoms of coronavirus. The third one is the tips to curb coronavirus, and the fourth one is that the steps which has been taken by the Indian government so far and how these steps are different from the steps which are being taken by the government all across the globe. So here the first one is what is coronavirus? The 2019-20 coronavirus pandemic is a pandemic of coronavirus disease 2019 caused by the severe acute respiratory syndrome coronavirus 2 SARS-CoV-2. The disease was first identified in Wuhan, Hubei, China in December 2019. So this definition means that coronavirus is a respiratory syndrome and COVID-19 is a family member of coronavirus. Like many people are misconsidering coronavirus as a virus, a soul, but COVID-19 is a part of the coronavirus family and coronavirus is the name of the family. There are so many viruses which comes under coronavirus and COVID-19 is one of them. Now the next thing is that they are talking that the first this disease was identified in Wuhan. It means the outbreak of this coronavirus is a Wuhan city. Now here one more question arises is that there are three terms: outbreak, epidemic and the pandemic. Now what's the difference in between three terms? Outbreak, it means that Wuhan is an outbreak of this coronavirus because this virus has initiated from Wuhan city. So the outbreak center of coronavirus is a Wuhan city. Now when this virus has spread all across the China, then it has become a epidemic. And when this virus has spread all across the globe, then it has become a pandemic. So this simply means that the outbreak center of coronavirus is a Wuhan city, then it has spread all across the China, it has become an epidemic, and then when it has spread all across the globe, it has become a pandemic. Now moving to further, we'll talk about the mode of transmission. Like many people I have seen, they are scrolling and they are frequently asking this question that what is the mode of transmission of this COVID-19? Okay, so the very simple answer to the very simple question is a human to human transmission via respiratory droplets. Like this virus is being transmitted from human to human. It is a communicable. Okay, that's why we are frequently talking about social distancing and just to stay away from the person who is suffering from cough and cold or a fever. Okay, because you never know that who would be the sufferer of this coronavirus. We never know, so we should maintain some distance with the person who is suffering from these kinds of symptoms. So it will create a problem for you because you never know. Okay, so moving to further, incubation period, that is 1 to 14 days. Now we could see many people, they are coming from different countries to the India. So here we are talking about incubation period. Most of the times when a person go for testing, they test negative for corona. Okay, but after few days, after 6 or 7 days, when they go for testing again, they would be test positive for corona. And just at that time they shocked that when they came it was negative, and then they are being shown positive for corona. So it simply means that the incubation period of this virus is a 1 to 14 days. Might be at the initial stage you wouldn't show the symptoms of this virus, but later on after 4 or 5 days you would develop the symptoms for this virus. That's why people are being frequently advised that if they are coming from the other nations, they should kept themselves isolated. Like in they should kept themselves isolated. You could say uh, you should keep yourself in a separate room, and you're not allowed to meet persons, okay, if you are suffering from such mild symptoms, because you never know if you would go and meet other person, so you should transmit these this virus to the other person. So all who are coming from other countries are requested to please keep yourself in isolation, even though you are shown negative for the corona. Okay. The third is prevention steps. Avoiding close contact with sick individual, frequently washing your hands with soap and water, not touching the eyes, nose or mouth with unwashed hands, and practicing good respiratory hygiene. Okay, so these are the prevention steps like you could take if you are if you have a trouble history, then you could follow these kinds of prevention tips, as it always being said that prevention is always better than cure. So what is in our hand is prevention. We could only take prevention because we don't have cure. Moving to further, I'd like to talk about the early symptoms of coronavirus. So the very early symptoms of coronavirus are fever, dry cough, and the fatigue. And the fourth is a breathing problem. So might be if you are showing these kinds of symptoms, if you have a high fever, dry cough, or a breathing problem, then you would might be the one of the sufferer of this virus. So at that time I would suggest you should go for testing and get test as soon as possible. Then you will get to know that whether you are negative, you are corona negative, or you are corona positives. Like the most common symptoms which are being presented by World Health Organization around the globe are like people who are suffering from this coronavirus, who are corona positive. In those people, it is found that 88% of the um people who are coronavirus are suffering from fever. It means that fever is the major symptom of this coronavirus. So people, if you are suffering from fever, if you are suffering from high fever and dry cough, just go for testing as soon as possible. The second is that 68% of the corona positive people are suffering from dry cough. It means that dry cough is the next symptom to the fever. Okay, if you are suffering from a dry cough, then you would be one of the victim of that virus. The third one is the fatigue, that is 38% of the total corona people are suffering from fatigueness. Okay, moving to further, 33% are suffering from cough and cold, 19% corona positive are suffering from shortness of breath, 15% are suffering from joint pain, 14% are suffering from sore throat, 14% are suffering from headache, 11% are suffering from chills, 5% are suffering from vomiting, 5% are suffering from stuffy nose, 4% are suffering from diarrhea, 1% are suffering from coughing up blood, and 1% are suffering from swollen eyes. So friends, these are the basic symptoms which you will uh, be you will suffer if you are corona positive, in which fever is one of the major symptoms. So you have to keep in mind these symptoms, as this report is presented by World Health Organization. So it is authentic and it is relevant in itself. Now moving to further, the third topic is the tips to avoid coronavirus. Now many people, they are frequently asking this question, how we could avoid this coronavirus. Like, it has become a matter of great concern, and people are scared of, people at their homes, they are scared of, people who are moving in streets and roads, they are scared of this virus, that they would be that one of the sufferer of that coronavirus. So I would suggest to everyone that don't get panic. Okay, don't get panic. Just be calm. Because when you get panic is a problem in itself. Okay, so I would suggest to don't get panic. Just be chill. And the tips which I'm telling you, just keep these tips in your mind and just live freely as you can. Okay. Now the first tips which you could follow to avoid coronavirus is a work upon your immunity. People, this tip is the very major tip, and I have mentioned this tip at the first because while I was searching for the different tips, I was just doing research to get some very you could say very relevant tips for you that you could follow and you could curb with this problem. I was studying that most of the sites, they have covered the like direct, you could say the direct solution of the problem, like don't touch this, don't touch this, don't touch this, try to do more work with your legs, like make your hands on the rest position. No, I have included one point which I have find nowhere, which is to work upon your immunity. This is the very major prevention of this coronavirus. Like, if your immune system is stronger, then you could fight with that virus. But if you have a weak immune system, you can't resist with that virus. You could take a very current example of that famous actress Kanika Kapoor. She came from London and she met many people in the party, and many people they get in direct contact with Kanika Kapoor, but they are showing negative for corona. So now you could say that she was corona positive, like for the second or third time she has shown corona positive, but still the people who directly came in contact with Kanika Kapoor, they are not the corona positive. So what could be the reason behind it? The very simple reason, their immune system would be so strong that they are able to fight against this virus. So I would suggest you to work upon your immune system. Try to eat more healthy you can. Try to eat healthy fruits. Try to eat green vegetables. Try to eat sprouts. Okay, which will enhance your immune system. Try to increase protein, minerals in your body, which will ultimately fight with this virus and help you in curbing with this. I have seen so many cases of coronavirus all across the globe which are showing improvements, um, which are showing improvements even though they are victim of this. Okay, just because they have a good immune system, they are curbing with this virus in home itself, because they have a good immune systems, and that's why they are able to fight against this virus. So this is one of the major prevention tips in order to curb with the coronavirus. The second one is distance. Now the second step is very important, that talks about social distancing. As we all know, this virus is being transmitted from human to human, so we have to keep mind that we should not come in direct contact with the people, because we never know who would be the sufferer of this coronavirus. Okay, so work upon this formula, social distancing. and later on I'll tell you like what's the advantages of social distancing for the country like India. Okay, now the third tip is look for the automatic option. Now this is a like little prevention you could take, like when you have been travel, like when you are traveling, you could use automatic options instead of direct touching the things. This could be one of the prevention tips, you could say. Like you could use the automatic lifts instead of just touching one and just pointing your finger on that button. You could resist yourself. This is the third prevention tips. Now, the fourth one is wash your hands every time you get home. This is the very direct solution as the sanitizers we are using. Try to keep your as sanitized as you can, okay? Because we are using sanitizers, Dettol, which kills 99% of germs in hands only. It means that when it will finish the virus in your hand, then there is no possibility of transmitting the virus further, okay? So this could be one of the prevention to curb um, with this virus, okay. And World Health Organization has also suggested this prevention tips that people should wash their hands more they can. That's why you could see that these days when you go to the markets, there is a huge shortage of the sanitizers, Dettols, and different hand washes, okay. Now the fifth prevention tip is exercise and meditation. This is also one of the point which I have included because I have myself experienced this. Exercise and meditation, it energizes your body and it helps your body to fight against the virus. Like meditation and exercise, if you are just doing exercise, it means that somewhere your body is working, somewhere your organs are active. Instead of just resting on the beds and just sleeping, you should suggest that you should go for exercise, you should go for meditation. They are somewhere they would help you in curbing with this virus. That's why Ramdev, he keep on talking about yoga and yoga. So somewhere I feel that yoga or exercise, these are the steps which could curb this virus, and it do enhances your immune system too, because the protein which you are taking, the minerals which you are taking, somewhere they are enhancing your immune systems. And this exercise and your this meditation, it it increases your efficiency to work. It increases the efficiency of the organs to react more faster than before. So this could one of the prevention tips, okay. Now the last topic which I'm going to cover is the steps which has been taken by the Indian government so far, and how this is different from the steps which has been taken by the other government across the globe. So here I would like to tell you that our Indian government is working upon social distancing. Okay, that's why he has announced the 21 days lockdown for the entire country. Just because social distancing is the only formula to curb with this issue. Like the cases are increasing rapidly, and India has an enormous population. So this is the only thing which is in the hand of India. Because when you compare India with the other countries, because India is a third world nation and still a developing country, in comparison to the developed country like America, Italy, Spain, China, they are somewhere developed, or you can say more developed than India. And they have more resources, they have more medical facilities in their countries, which India don't have. So India has to work upon that only. We don't have huge number of doctors and different, you can say, a good medical facilities, more hospitals we don't have. So what we could do is that we can work upon social distancing. Like if you see the data of other countries, and when you compare the data of other countries with India, you would praise our country. I would praise my country, because I could see like India has an enormous population. Still, If you calculate, if you'll see the average data as per the average population, you could see that there are only 600 in total, positive cases in India so far, I think, and around 9 to 10 deaths yet. Okay, but if you see the data of other countries like America, China, like China, you could say that it is a major victim of this virus, so might be the data is so high. But when you see Italy, Spain, like thousands of deaths are being taken place every day in their country, knowing that the country is has good medical facilities, they are arranging resources, but still they are not able to fight with this virus, just because at the time when when the Italy announced this step of social distancing, people of Italy and Spain, what they did, they just went on vacation. They was thinking that okay, the government is giving holiday, so we could plan some trips and all, and they just made groups and they just went for vacations, they just went to enjoy their holidays. And at that time, it has created a major problems for the Italy and Spain. At that time, the graph for the corona positive people was, you know somewhere it was increased, just because they haven't taken the decision of government to be serious so far. That's why. But the people in India, they should get some experience, they should get some points from Italy and Spain, that what they did, we should learn something from these countries, like knowing that these countries are well equipped with the medical facilities and other resources, but still their graph is increasing. And when it comes to India, still our graph is at low. Okay, when you compare your graph with your total population of the India. So at that time, at present time, you could say that social distancing is the best way to curb with this virus, to just to prevent this virus. Because India don't has so many medical facilities, so many hospitals to get people equipped. Okay, so what our government has decided, they has decided just to treat those people who are corona positive, and the people who are safe, they should stay at home. If the people who are not showing these kind of symptoms, and if they would come on roads, and if they will get in the direct contact with the positive ones, they would get affected with this virus. And at the time, it will be difficult for the government to manage this problem as a whole. Because if you see this problem at a macro level, it is very, it has a very escalating effect for the country like India. That's why the government has decided, like if we have a limited number of beds, so we should treat that patient first, and we should not take any more new cases. That's why government is keep requesting and keep requesting, just please stay at your home, just don't go out of your home, stay away from the people, just to maintain distance with the people, say pranam, don't say hello. Okay, that's why our government is keep talking about these kinds of preventions. Okay, so this is the last topic which I have discussed, and I have covered that how this step is different from the other countries like China. If you could see, if you could say, you could see that China has built hospitals in within 2 or 3 days, and just shut those hospitals in coming, in 2 or 3 days. So you could say like the medical conditions, or you could say medical facilities in China's, the resources, China is very resourceful. Okay, they in within 2 or 3 days, they have built one company which is making sanitizers and masks. So you could now you could understand like the country which is very resourceful, and which is taking decision so rapidly, so somewhere is able to fight with this, this pandemic. Okay, but the country like India, which is still at a developing stage, and we don't have that medical facilities in our country, how could we fight with this pandemic? So this is the only solution, that is a social distancing. just keep yourself away from the people, stay at your home. So at last, I would like to say that people, this is the high time we take care of this. Okay, the government has announced a wonderful step of social distancing, and just you could say that locking down the entire India, you could say, is the good initiative when you see the problem at a macro level. Okay, so I would suggest you to just stay at your home, stay safe, okay, maintain distance with the person who are the sufferers, or you could say who are suffering from problems like cough and cold, fever, or you could say breathing problem. Okay, just don't go in direct contact with them. Okay, and one of my colleague, she asked me one question that yaar, these days I'm not able to decide what I have to do in home because they are getting more, like they are getting bored at homes. So I would suggest that, see, there are ample of things to do at home. Okay, like me, I'm sitting in my home. Okay, what I'm doing, I'm just making this video and I'm just imparting knowledge regarding this issue to you people. Okay, so you could decide something like this, or you could play games, you could spend some time with your family. Okay, you could eat, you could cook something. Okay, so whatever you like, just do at your home. Read books, watch web series, watch movies. Okay, spend time with your family, play games, talk. Okay, make videos like me and just impart your knowledge. And whatever you want to do, just do it. But I would suggest that stay at home, stay safe. And this is the only, you could say, the solution of this problem at present. So far, the World Health Organization has said that doctors, and you could say the scientists all around the world, they are saying that it will take around 1 year to make the, medicine for this COVID-19. So 1 year is a, you could say, is a long period of a time. Okay, so we can't wait for 1 year. What we could do is, like, we could just stay away from the people. We could follow this prevention of social distancing, and somewhere, if our government will see that it is helping, then it would be good for India and for the countries like America, China, and other different countries who are the victim of this virus. Okay, thank you for this.